Hello, everyone. We are going to continue our work on H66 and spend some time on the national perspective to learn a little bit more about what other states are doing and the impacts that other states see. And so we're going to start off with Ms. Szabo. Thanks for joining us.
Hi, thank you so much for having me. So my name is Vicki Szabo, and I'm a senior fellow focused on paid leave policy and strategy at New America, which is a think tank in Washington, D.C. I've been working on paid family and medical leave at the state level and at the federal level for like the last 13 plus years. So really excited to see this conversation move forward in Vermont with HB 66. I'm going to talk a little bit about why this is urgent for Vermont families, and then also just try to provide some national context, and happy to answer questions about anything and find information for you if there's something that I can't answer off the top of my head. But essentially, I'm so glad that you're considering this policy. It's urgent for Vermont families, just as it is urgent for families across the country to have access to paid family and medical leave. And it's politically urgent as well, because getting a real program in place that offers comprehensive universal coverage for Vermont workers at a time where there's another policy that's potentially out there that could slow progress, I think creates extra urgency this year to craft a policy that is workable for Vermont's families and communities and for businesses, and that will add to the economic growth overall. Just for some context, in the US overall, just 24% of private sector workers have access to paid family leave. Around 40% have access to short-term disability insurance. In New England, 28% of workers have access to paid family leave, which means that the vast majority are dealing with untenable circumstances when they need to care for a new child or make sure that a seriously ill loved one needs care. And only around 40% have access to short-term disability insurance in Vermont as well. And there are huge skews nationally by income, by occupation, by part-time versus full-time. And these haven't closed. These gaps have actually grown over time over the past decade. I'm happy to share more information about that. In Vermont, just for context, unpaid FMLA leave, according to researchers at Brandeis University, is affordable and accessible to just 35% of workers. So that's 65% of your state that can't afford an unpaid leave or faces serious financial hardship. The impossible choices that workers and families face when a child needs care or a loved one needs care or a worker themselves needs to take a leave has economic implications for the state. Reduced workforce participation and ripple effects and what that means for businesses that may be looking for more workers, lower earnings and less savings for families, and particularly families who are headed by hourly workers or lower wage jobs. This causes significant financial hardship that also has ripple effects. Poorer health and health outcomes and increased public spending on other programs. There are huge unmet costs of the status quo that families and communities and the public are absorbing right now. I also recently did a deep dive into rural workers' access to paid leave and the special need for paid leave in rural communities because of distances to healthcare. And so I've shared a document with the committee that speaks to this in Vermont specifically. But last year, working with some researchers at a health center at the University of North Carolina, we did a deep dive into rural workers' experiences. And in Vermont, where 2/3 of the state has a rural population, this is particularly important. Rural workers have less access to both unpaid leave under the Family and Medical Leave Act and less access to paid leave of various types. And that is particularly true for women, Latino workers, which I know is a very small percentage of your state, but relevant overall, and for people who are living in poverty. And that's because of the types of jobs and the size of businesses in rural communities that leave those workers out. It's just another reason why a universal policy and a universal policy that's crafted like HB 66 is so important. Rural communities also have a greater need for paid leave because of aging populations and declining share of working age people who are able to care for those aging loved ones. And most especially, the data dive that we did was into how far health services are, hospital-based healthcare for rural communities. This is true across the country, that rural communities are around 3 to 5 times further from hospital-based services of different kinds than urban ones are. And in Vermont, this is true as well. So in Vermont, in urban census tracts, healthcare facilities for NICU care, pediatric care, obstetrics, cancer screening, cancer treatment, and cardiac care are only about 11 to 12 miles, typically from a urban census tract. For rural census tracts, the distances are far greater. NICUs, for example, are 50 miles on average away from rural census tracts in Vermont. Pediatric care is 31 miles on average from hospital-based pediatric care. It's 31 miles from rural census tracts in Vermont. Cardiology care in a hospital is 23 miles, and cancer treatment is 21 miles. Obstetrics care is nearly 19 miles. So much, much further for people in rural communities to travel. That means longer travel times, more burden on caregivers, but less access to paid and unpaid leave to be able to have the job security and the income that they need to care for themselves and a loved one. A study in Vermont of cancer patients showed that they were less likely to have access to paid medical leave or to use paid medical leave, and they were more likely to retire from their job after a cancer diagnosis than people in non-rural areas of Vermont, except where there was more access to paid leave and more workplace flexibility. And that's, again, because of the kinds of jobs that tend to be concentrated in rural communities that tend not to offer paid leave benefits or flexibility. NICU babies also have much better outcomes. Their parents are better able to visit them when a NICU is within a 30-minute drive. And the exacerbation of those long distances, the 50 miles in Vermont, coupled with lack of access to paid leave, also likely poses a particular burden. So let me pivot now to the good news and talk about what states have done. So there are 11 states plus the District of Columbia that have adopted paid family and medical leave insurance programs like the one that you're considering here. And Vermont is one of several states that are looking at paid family leave this year. I think we're likely to see some other states adopt new policies as well. These policies are all set up as social insurance programs, as this policy is. They all offer comprehensive paid leave for new parents, people caring for seriously ill, injured, or disabled loved ones, with a broad definition of family, like this bill has as well. And they all offer wage replacement, and especially the new programs offer wage replacement that is affordable for low wage workers, as this bill does as well, but also generous enough for middle wage workers to use, and that promote gender equity and men taking leave in order to help reduce both the gender inequities in homes and in workplaces and the economic outcomes for families over the long term. So just a few highlights that I wanted to address, and happy to talk in more detail about any of this. As I said, comprehensive leave is important. Every state that has adopted a paid leave program makes it comprehensive. Every state has included workers in businesses of all sizes, except for one. But this is a core tenet. You should have access to paid family medical leave no matter where you work or what your job is or what your employment situation is. We've seen from an analysis of state paid leave programs claims filings that the use of leave and even the attempt to use leave is very responsible. Claims that were filed in the most recent years in every state for which data is available are just 3 to 5% of the total workforce. So people are using these programs in the ways that they're intended. And if anything, utilization is lower than it should be, not too high. That's often a concern that comes up. These programs are sustainable and affordable. All of the programs that look like the program that you're looking at here have payroll contributions that are paid for by employers, employees, or both, that range from 0.26% of payroll up to 1% of payroll. So the maximum in this bill is right on track. And these programs are sustainable over time. In fact, often the payroll contributions get reduced as the program sort of takes hold and the administrations see what's needed to sustain these programs. And this payroll contribution model that is universal and comprehensive is tested. It works well. It's been in place for nearly 20 years in California, and there have not been issues. Businesses as well as workers benefit from these programs, for small businesses in particular, and I know Molly is going to talk more about this. These programs create the ability for businesses to make sure that their employees are taken care of without having to absorb the full cost. And then finally, I just wanted to address, Vermont has been a leader on paid sick days. Most of the other states that have adopted paid family leave programs also have paid sick days. This is a complementary policy that makes sure that people have both the short-term time and the longer-term time that they need. And finally, what you can expect. What we know from data in other states is that there are key outcomes: higher labor force participation for new mothers and for family caregivers, higher earnings over time, lower costs of SNAP and other public assistance programs, reduced use of nursing homes, which means reduced costs to Medicaid, better health utilization, particularly for children, making sure that babies are getting the immunizations they need, better outcomes in terms of just overall child health and well-being, as well as maternal health and well-being, some evidence of better outcomes for people who are receiving care from loved ones or people who have their own serious health issue, and no negative impacts on businesses. So I'm happy to talk more about any of that as we go through this hearing, but really just applaud your efforts here and hope that you're able to get this done this year. This is a common sense policy that really makes up, the costs are far outweighed by the benefits. These programs are sustainable, affordable, and really make an impact both for individuals and families, businesses, communities, and the economy.
Thank you. I would love to dive a little deeper into some of the rural aspects of this that you were talking about. I think you gave a lot of detail about sort of access to healthcare and how that complements or how family leave would complement that, family medical leave. I'm curious about sort of, I think you mentioned in passing, rural aging demographics and how that fits in. And so I'd love to hear a little bit more about that. And then also sort of the nature of rural businesses being smaller and sort of that piece, if you have a minute for that.
Yeah, absolutely. So and I can send the whole report over. I haven't looked specifically at demographics in Vermont. You all would be much better experts on that. But overall in the country, rural areas are losing younger population. They have lower rates of working age people and lower labor force participation rates. And they have higher rates of people who are getting older and in need of care. People in rural communities expect their care needs to grow over time because of the aging of the population in those states. And I can get you more specific data points from the report as we go.
So we're sometimes the oldest and sometimes the second oldest state in the country. And so I guess I'm curious to sort of just go a little deeper onto how family medical leave. I think people often think about birthing families in the context of bills like this. And so what does it mean in an aging state?
Yeah, so what it means is, we all have examples of aging parents who need care, whether that is like ongoing care where you need to find a paid caregiver, but in the interim, a family member is needed to provide care, whether it's coming in at urgent events where you, for example, the reason I actually did this rural report was some focus groups in Missouri several years ago, where very conservative voters were talking about the need for paid leave, and they all had examples of needing to take a loved one to care that was far away. And so one gentleman, for example, talked about how his mother had a stroke and she needed to be in a hospital 90 minutes away. And his employer, he worked for one of the large telecom companies in a retail location. And the company said, like, if you go, don't come back. And he was stuck needing to, his mother was 90 minutes away. He needed to be with her in the hospital. He needed to help coordinate his care. And yet he didn't have the leave that he needed. Can come up with skilled nursing facilities. Skilled nursing facilities in general are also further away from rural areas. So needing to get somebody situated there, needing to make sure they have care. And then also the paid caregiver supply is lower in rural communities. And so you may have more periods of time where you need a family member to provide care. And then just on the nature of jobs the employers tend to be smaller and so are less likely to offer leave on their own. They're more likely to be in industries that are less likely to provide paid leave, and they're more likely to be hourly occupations that might not have access to paid leave. And I see Molly came off, and I know that she has firsthand rural experience, so I will pause there.
Okay, and actually, Molly, we could sort of move to you if you want to, unless I think we have one more, or if you just want to sort of hold your answer to that until we're, okay.
Happy to do whatever is easier
Okay.
for you. I had a point about older adults, but happy to throw it in when I talk, whatever's easier for you.
I think that would be great. Thank you. And then I think we have another question for Vicki.
Yep. I'm curious how many states that have family leave also have safe leave?
That's a great question. I can look that up. Molly might know the answer off the top of her head, but it's a few at least.
Yeah,
And
it's
also-
a growing handful have it included. New Jersey, Connecticut. Okay.
If you're gonna, can you introduce yourself for the record?
Yeah,
I
sorry,
apologize.
actually
I'm Molly Weston Williamson. I'm a senior fellow at the Center for American Progress.
and I actually have the answer to that right here. It's New Jersey, Oregon, Colorado, and Connecticut.
Thank you.
Oh, and do you know of any states that have started a program and then backed off or decided against it afterward?
No. So, well, very early on, Washington State adopted a pretty rudimentary parental leave only program. And then the recession in 2008 hit and they didn't end up funding it. And then they have since created a brand new comprehensive program that is fully up and running and sustainable and did a great job during the pandemic, managing the on-ramping of the program in the course of trying to stand up this program. There have been a couple of delays in implementation in states, particularly because of the effect of the pandemic. So where contributions might have started to be collected a little bit later or payments came a little bit later, but no, states that have adopted these programs have committed to them and they are successful.
Okay, which brought up one more question. Do you know how much lead time various states gave in order to build up the resources to fund it when they start offering the benefit? How much time most states have allowed for that?
Yeah, so it really ranges anywhere from like 18 months to a couple of years. And we can get that for you more specifically. But it's, yeah, there is a lead time to get the program stood up and then to start collecting the contributions so that the fund is sustainable by the time you start paying the benefits out. Yeah.
And we're gonna hear from a few folks who are the leads in their states for implementing this, so we can sort of.
Okay, good, thanks.
Representative Odie.
Thank you. You said that the utilization could be higher. What do you see as the obstacles to that? And I hear about having the family income go up and the employee and the employer, but if I asked a more child-centered question, it might be, especially for birthing parents or for adopting, whatever. It would be if the goal is 12 weeks and 12 weeks, if my goal would be 12 and 12 is 24 weeks, that gets you to 6 months, and that's really a nice age. And so do you see any states, this is a multi-question question, do you see any states saying, look, you can set this up so that both parents can each take 12, or you can split those weeks so that you get 6 months of a child being cared for at home?
Yeah, let me take your second question first and then go back to the utilization question. So yes, every state has gender equal leave. And if you are in a 2-parent family, each parent can take the time. So they don't include the kinds of restrictions like the Family and Medical Leave Act does, which if somebody's working for the same employer, they can be forced to split their time. But just like the FMLA in general, 2 parents can each take the time that they need and give that longer period of time to care for a new child, for example. Does that answer that part of the question?
Could it, do you see anywhere where one parent could choose to take the full 24 weeks?
Let me come back to you on that. I think there are circumstances in like Massachusetts, for example, where if there is like a serious health complication of a birth parent, for example, you might have a situation where somebody could take time for that for up to 20 weeks and then the 12 weeks of paid family leave. But that would be an unusual situation. And it's one where it's actually the worker's own health issue that would be driving the longer duration. which actually leads to the utilization question. So I think there's a couple of reasons why utilization is sometimes lower than what you would expect. So one is policy design, and you all have mitigated against that factor here by offering job protection and by offering 100% wage replacement up to state average weekly wage. So one of the reasons people can't take leave is that the wage replacement is too low. In California, for example, the state program started at 55% of a worker's wages, and we saw that lower wage workers weren't using the program to the extent that middle wage workers were, and it's because 55% was too low, and there was no job protection for people that weren't covered by the state FMLA or federal FMLA. The other reason is outreach and education has been lacking. So workers might not know that this program exists. Employers might not tell their workers that this program exists. And that's why building outreach and education and community-centered, having community-based organizations help be conduits, thinking about how health systems and other touch points where people who might need paid leave learn about the program, having a portal that is accessible and understandable to people, having an application process that's intuitive. These are all very important pieces for take up. And actually my colleagues at New America did a project with New Jersey looking at how to improve the user-centered nature of their program. Washington State, for example, did a really good job getting businesses and the employer community to understand the program as it was ramping up so that employers could become partners in letting workers know about this program. So thinking about the outreach and education components is important. And then the last thing is really cultural, making sure that in addition to the job protections being embedded in the law, people don't feel stigmatized in their workplaces and don't feel like they are unable to take the leave that's available to them and that they are in part paying for through these programs. So it's sort of a three-part thing. It's about policy design, about outreach and education and the user-centered nature of the program, and then really about these broader cultural stigmas that a lot of people carry with them or feel, either implicit or explicit biases in their workplace. And some of that is about how policy changes culture. So we know, for example, in California, when the program first started, men were 17% of parental leave takers, and now they're 40%, more than 40% of parental leave takers. And some of that is about how culture and policy move together.
Thank you. That was a great answer. Thanks.
Thank you so much. Really appreciate this. And I imagine we're going to be reaching out for more resources as we go along and might have more questions. So thanks for being part of the process with us.
I'm happy to, I'll stick around. So thank you.
Thank you. Hello, Michelle.
Good morning. I just wanted to say, if you'd rather stick with the national experts, I'm happy to be pushed later, whatever your preference is.
Yeah, let's do that.
Okay.
Okay, thanks.
Yeah.
Hi, Molly.
Hi again, and I apologize for jumping the gun earlier. I'm Molly Weston Williamson. I'm a senior fellow at the Center for American Progress, where my work focuses on paid leave policy and advocacy at the state level and around the country, and have been working on paid leave work at the state and national level for many years at this point. Thank you again for the opportunity to speak today. I want to first just get back to some of the older adults pieces, but in general, what I was hoping to do is sort of talk a little bit about kind of where does Vermont fit in the national landscape on the key policy parameters, echoing some of what Vicki spoke to, and then really dive in on some of the small business pieces. So on the older adults piece, just one other thing to think about is that paid leave programs also support and reinforce retirement savings, particularly for women. Because when folks have access to the paid leave they need, they're able to keep working and keep earning more, which means they can save more for retirement. But also they're not having to tap into their retirement savings. So for example, some kind of serious health shock is one of the leading reasons that people have to tap their retirement savings early. And when you have a paid leave program, that can mitigate some of those impacts. So in addition to all of the health related reasons, I think when we think about the economic needs of an older population, I think that retirement piece is pretty critical. So I think in terms of this sort of scorecard idea, a lot of this I think Vicki has already spoken to, so I'll just be echoing her kind thoughts. But first, when it comes to coverage and eligibility, this is a bill that's set up to cover nearly all employees in Vermont, again, following the strong and established best practice from other states, but particularly the way that eligibility is set up is designed to make benefits portable. So if you're a Vermont worker and you say change from one covered job to another, which we know that particularly low-income workers are more likely to do, you're going to keep the benefits you have earned and paid for. And as the economy changes and evolves, that's really critical to ensuring that folks are able to make the choices that are right for them and their families without losing out on these benefits. So again, I think like Vermont is already doing an A+ job here. As Vicki spoke to, the sort of core three purposes that are covered in every state paid leave program are workers' own health needs, caregiving needs, and parental leave. Those are firmly covered here. Vermont would also join, as we talked about, 4 states that provide paid family and medical leave for domestic violence related needs. It would also cover bereavement, which is breaking a little bit of new ground. I believe the intent is also to cover deployment related needs, which most state paid leave programs also cover and are also covered in the FMLA. So again, when it comes to purposes, that comprehensive nature, Vermont is very much in line with what other states are doing and is very much in line with established best practices. On the family definition piece, so on who are the loved ones you can care for when they have a serious health need, again, Vermont is very much in line with other states. The overwhelming majority of states that provide paid leave allow it to be used for a child of any age, a parent, including a parent-in-law, grandparent, grandchild, sibling, domestic partner, and Vermont checks all those boxes. And in addition, this bill allows care for someone with whom a worker has a significant personal bond. And that follows with what a growing number of states are doing. So again, when we think about sort of where does Vermont fit in, I think this is a bill that's really reflecting those national best practices. There were some questions about duration that I wanted to speak to a little bit more. So 12 weeks is very much the standard go-to number that everyone is looking for, but most state programs actually allow workers to go beyond 12 weeks in at least some circumstances, particularly in relation to childbirth and pregnancy. So a number of states include a bonus, a couple of additional weeks beyond the 12 that you can receive if you have health needs in relation to pregnancy or childbirth. Different states define it different ways. As well as a number of states allow you to take medical leave for your own recovery from childbirth and then separately take your family leave. So typical recommendations are if you have an uncomplicated delivery, you're looking at like a 6 to 8 week medical recovery period. So in many states, you can take those 6 or 8 weeks as medical leave and then take your bonding leave. Again, it varies by state, but I think Vermont is very much in line with the overall approach, but there is some variation since I know that's of interest. Again, very strong wage replacement rates. I think it's clear why 100% is a good number. I don't think that needs a lot of justification. I'm happy to get into more of the details and example, but I do want to just highlight that I think the contribution rate outlined in this bill reflects all of the other thoughtful policy choices, while also providing a really robust benefit at a rate that's going to be affordable for workers and employers. And I think when you break down the dollars and cents, that really translates into why this is going to be a sustainable long-term approach. So again, echoing strong best practices, echoing what we've seen works in other states. When it comes to employment protections, which I think Vicki alluded to already, again, this bill provides this really strong foundation. And I think when we talk about, I just want to emphasize on that usage, like why are there folks in other states who need these benefits, qualify for them, but still aren't taking them? In many cases, particularly in older programs, that's because workers' jobs aren't protected. And if you have a right to the cash, but you don't have a right to take the time and come back, you don't have protection against retaliation for being away, you don't have the right to keep your health insurance while you're on leave, which is especially important if, say, you have a serious health need or you just had a baby. That's a real barrier, particularly for low-income workers. And I think to a large extent, if you don't have the right to take it and come back, it's not really a right to leave. It's more like a right to severance pay. And I say all of that to say, this bill already has really strong and robust protections here. I think it gives a really strong foundation for learning from what we've seen works in other states, while also really investing in, let's make this an accessible and equitable program that everyone can really use in practice. And I think Vicki already spoke eloquently to the need for outreach and education, but again, I just want to applaud that this bill already includes a firm commitment to exactly that kind of proactive outreach work that we know we need. Like when it comes down to it, it may seem obvious, but folks can't use a right they don't know exists. And what we've seen in other states is that it takes long-term continuing effort to ensure that all workers know what they qualify for and how to access it, but also that employers have the information and tools they need to get all the benefits they deserve from the law, but also to support compliance. And I think we've seen some really good examples in states like Washington and Connecticut that really highlight some good best practices there. And I think, again, the fact that it's already baked into this bill, I think it's a very strong foundation. I did want to talk just a little bit about some of the business impacts, and particularly, I think, the ways in which the benefits of paid leave to business build upon all of those macroeconomic and worker side economic benefits Vicki spoke about a few moments ago. And really, I think the point I want to make overall is that guaranteeing paid family and medical leave is an investment in Vermont businesses, especially in small businesses. And I think it's an investment that Vermont can't afford not to make. What we know from the data is that paid leave helps businesses hire the best employees. People are more likely to recommend a job to a friend if they have paid leave. And small business owners who offer paid leave say that they do it because they think it's an economic necessity from a recruiting perspective. And small business owners who can't offer paid leave say they're suffering in hiring because they can't recruit the best employees if they can't compete on benefits. And it's not just for hiring, it's also for keeping folks. So paid leave boosts retention. We know that turnover is really expensive. The standard estimate is that replacing a worker can cost somewhere around 40% of their annual salary, from the cost of hiring, advertising positions, from training, and also just productivity. Someone who's been on the job for a while and knows what they're doing is always going to be more productive than somebody brand new. And so what paid leave programs do is they help employers keep the quality employees they've already invested in and save money by doing so. And all of that translates into why we know paid leave supports boosting productivity and ultimately supports boosting the bottom line. Because when you start seeing all of these benefits of better hiring, better retention, better productivity, reduced turnover, all of that is really translating into bottom line benefits. Which brings us to, as we think about the national landscape, today, 1 in 3 Americans live in a state with a paid leave law, including a growing number of New England states who I think are sort of key economic competitors. And what that means is when we see all of those benefits, which employers in states like Connecticut or Massachusetts are already getting at an affordable cost, I think there's a real risk of employers in states that don't make that investment getting left behind. Because they're getting put at a competitive disadvantage. And I think that's why it makes so much sense that Vermont is stepping up to make that same investment and support for Vermont businesses. Particularly, these kinds of programs are really essential for small businesses. Because if you're, a Fortune 500 company, you can look at that data and say, I'm just going to pay out of pocket. I think this is so valuable from a hiring and retention perspective. We're just going to make the investment. But if you're a mom and pop Main Street business, that may just not be feasible for you, which is why you need the benefit of this kind of time-tested social insurance approach to make those benefits affordable and really level the playing field for small businesses. I'm happy to talk more to this, but I also want to highlight that because this bill would allow self-employed folks to opt into coverage, I think that's a really strong support for entrepreneurship and for helping folks who want to strike out on their own be able to do so. And finally, I think just to highlight, in every state that has passed paid leave, concerns have been expressed about negative impacts on business, and the data just don't support that. What we've seen over and over again in states that have adopted these programs is that businesses adapt easily, it's no big deal, that businesses really see the benefits. So in addition to all of those turnover and productivity and recruiting benefits we talked about. We also see things like employers in New York, when New York's paid family leave program went into effect, said it made handling employee absence easier. And so I think overall, what we really see is employers adapt quickly, they get all these benefits, and that's why in states that already have paid leave programs, most employers support the programs. And in fact, often there's research out of New York and New Jersey, which found that when employers have employees who've actually used the program, support goes up, which I think is a really interesting data point for showing that employers who have the most firsthand experience are the ones who are most supportive, which really points to the strength of these programs and all of these key lessons that I think this bill really reflects, having learned from the national perspective. So happy to talk more about any of this or get into questions, whatever's helpful to you.
Yeah. Oh, okay. I initially got interested in this policy from the perspective of wealth gaps. And so we got into that a little bit in the context of retirement, and I think Representative Odie's question about sort of in an opposite gendered relationship, both, members of the household taking leave, the impact of that on the pay gap. But I'd love to sort of talk a little bit more about that from a long-term perspective.
Absolutely. And I think paid leave plays into both increasing pay equity, but also the separate but related question of wealth equity. So I think the retirement example is one key piece of this, but also just more broadly, when we talk about those statistics about whether unpaid leave is both accessible and affordable, it's not just that you need to have the right to take the time, but you need to be able to afford to take it. And we think a lot in terms of income gaps, but just fundamentally, a family that is living paycheck to paycheck, that has limited savings, that needs every dollar coming in, even a short-term leave is just not feasible when folks don't have access to that kind of savings and wealth. And that's exactly the kind of gaps that these programs can fill in. And that means both, here's the cash so you can take this leave that you desperately need right now, but also you're not blowing out whatever limited savings you have to cover that time, right? And you're returning to work and not getting pushed out of the workforce. And that's especially important for caregivers, for folks with chronic illnesses, for moms who, when they don't have the kind of leave benefits they need, often do get, either in the short term or long term, pushed out of the workforce, which means reduced earnings and reduced savings for that period of time, but also lifetime. Reduced earnings, because even if you make it back into the workforce, you're going to earn less each year because of that gap, all of which contributes to the overall kinds of pay gaps and wealth gaps we see. I also think this wealth piece really plays into thinking about paid leave and entrepreneurship. So right now, the folks who can afford to step out and start a business on their own are the folks who can either afford to just take the risk that if they get sick or they get hurt and they can't work, they'll be able to keep paying their bills, or they can rely on a partner's income or some kind of family wealth. But instead, if we say we're going to invest as a state in providing this universal insurance system that's going to allow the self-employed and entrepreneurs and small business owners to opt into coverage for themselves, I think that's really opening up the opportunity for entrepreneurship. That's really opening up the ability for folks to really sort of jumpstart the state economy, regardless of their access to independent wealth. And I think that has huge equity implications. And I think really goes to building the kind of vibrant, thriving economy that I know the legislature is really invested in building.
Thank you. I appreciate that. When we sort of talk about building a tax structure that'll work in the future, I think a lot about our rapidly aging state, which sort of at the end of the day is like, tends to be a lot of much older women, because women live much longer than men. I'm sorry to all the men at the table, or congratulations, all the men at the table. And we know that, women tend to have much less money in retirement than men. And so that's just like something that when I think about sort of what our population will look like in 20 years from a tax-based perspective, I worry about all of these much older women that have taken massive amounts of time off for caregiving duties, and what that will mean sort of long-term for us all. Yeah.
Do you, have any of the other programs in the other states had the ability for, if one parent is going to take 12 weeks, they can say, I'll take 6 and give my other 6 to my spouse and let them take the other 6?
Not in the United States. So there are a number of other countries that do have kind of this idea that like the leave belongs to the child, and you get into how you sort of divide it up. The US has pretty firmly, and this goes back to the FMLA, really stuck with the idea that the leave belongs to the worker. And so, you know, for example, if you have a heterosexual couple, it's not the baby is entitled to 24 weeks. It's mom's entitled to 12 and dad's entitled to 12. And so there's benefits to that. I think that there's trade-offs too, but I think there's real reason to think that supports gender equity. You know, sometimes in Europe, you'll hear folks talk about use it or lose it, paternal leave as a way to incentivize men to also take leave, which we know has, when men take leave, they have more rewarding experiences as fathers, they stay more involved as fathers, and it really benefits in the sort of equitable distribution of labor in the household. And so doing that idea that it's not, you know, we can sort of allocate it, but the idea that each of you as a parent is independently entitled to this right is designed to be an investment in gender equity. It's designed to be an investment in really thinking about all of the kinds of folks who are parents deserve equal leave. So it's a policy choice that we've made, but pretty universally, the US has come down on the side of not being able to sort of trade off or swap that leave. And I think that is the right choice, but it is a distinctive feature of the US. And frankly, I would say gender equitable parental leave is maybe the only place where the US is really world leading, in part because we're so far behind in so many other ways. But I think there's real value there.
Earlier on in your presentation, you listed off quite an impressive list of reasons why businesses should do this and the positive results from that. So can you tell us why more businesses don't do this voluntarily? If there's so much positive, what's holding them back?
So I think the real answer is cost. I think the real answer is that if you're in a situation in which you have to pay, especially for benefits not for workers on medical needs, so for bonding or caregiving, where there's not the same kind of like robust backup that we have in disability insurance, it's really expensive if you have to pay a worker's full salary or some large portion of their salary out of pocket. And that's just not realistic for large numbers of businesses. So when you ask small business owners, why don't you offer paid leave? The number one reason with the bullet is cost. And that's exactly the problem that bills like this are responding to. Because they're saying, we know you see the benefits, we know it's going to benefit you. We're going to make it affordable for you by making this investment in this sustainable universal insurance system where making it universal and comprehensive makes it cheaper for businesses, it makes it cheaper for workers, and gets you those benefits. So if you think about, so in a 12-week, 100% program like the one envisioned here, an employer's costs, what they're contributing to the cost of an employee's paid leave through the payroll contributions, in total for a year is teeny tiny in comparison to even doing one 12-week leave. It's like less than 15% of the cost. And again, most people aren't going to take the leave. So what we're really talking about here, I actually ran some examples. So if you're a small business owner and you've got an employee who's making minimum wage, right? So Vermont minimum wage, you're working 40 hours a week. We're talking like $5.25-ish a week. As an employer, you're paying $1.45 a week or about $75 a year. That's not nothing, but that's so much cheaper than if you have to pay for a 12-week leave or even a 6-week leave out of pocket. And that scales up at each step of the income level. So even if you have, say, a pretty high income worker, so someone who's making $100,000 a year, which is about $2,000-ish a week, that employer is only paying about $5 a year, or about $275, about $5 a week, or about $275 a year. Again, not nothing, but for that worker, it's so much cheaper, even with the cap than you'd be paying out of pocket. So I think really, truly, it's the dollars and cents of it all. It's too expensive for a lot of businesses to do out of pocket, which is all why we all need to band together and really, I think, have our employers back by making sure that they have access to the kind of benefits and the kind of paid leave systems that they'll benefit from, that their workers will benefit from, at an affordable, sustainable, predictable, because it's also not going to come out of nowhere, right? Cost to do it. So I think that's really, there's other reasons out there, but I think that's by far the biggest number, especially for smaller or newer businesses.
And can I ask one?
Yeah,
more
absolutely.
question? So along that line, I know, well, I have a family member who is expecting a baby shortly. She has been given 12 weeks leave, but no pay, but they'll save her job, or they will save a job for her. She's a chemist and makes, well, for Vermont, she makes a good salary, over 100,000. And the company is having to replace her position because they can't afford to be without that position. It's a laboratory, a highly skilled thing. So as you were talking, I was thinking about that. I suppose it's different for every company, wouldn't it be? And it depends, you know, they compare her to the worker in the grocery store, the minimum wage worker. It's different for every company. How could we even that out so that it isn't such a sacrifice for one company where they've got to pay a new $120,000 employee and the other one could maybe even do without that employee? How could we even that out?
So I think the bill before you actually already does a really strong job on that. So one, what we know from the data is that most employers cover absences by temporarily reassigning work. That's what the data of a couple of different states show, but they also have other options, right? So depending on what kind of work you're talking about, it could be hiring temporary workers, but that's not the most common approach. It could be giving overtime. It could be deciding to temporarily postpone some projects. Employers are used to this, right? Employers are dealing with this every day, whether there's a paid leave system or not. People get sick, people get hurt, people have babies. They take the time. Employers have figured out how to address it. But what this bill does is we're giving employers a new tool for responding to that absence, because since the insurance system is paying for the workers' pay while they're out, that means that the business still has in their bank account the money they were going to use to pay that worker's wages if they hadn't gone out on leave. And the business gets to decide how they want to use that resource. So depending on what makes sense for them, that could be hiring a temp worker. It could be paying overtime or additional hours for existing workers. It could be saying, we need to postpone this super specialized project that only this person can do, but we're going to save this money so that we can use it for the investment that we need in a couple of months. So really what we're doing here is we're saying to businesses, you know best. You know what makes sense for your business to cover this absence, but we're going to give you this really flexible tool that you can use in whatever way works for you to cover that gap, knowing that all businesses need support and resources to do that well, but exactly what that looks like, exactly as you said, it's just going to vary based on the employer. Like a fast food place might say, we're just going to give some extra hours to our existing workers, but a highly skilled worker, you might just need a different approach.
Thank you.
Thank you. I would love to spend our last 10 minutes here hearing from Michelle to sort of like bring the national context down to the local, if that works for all three of you. Great, thank you.
Good morning, everyone. Michelle Fay with Voices for Vermont's Children, clearing the room out. A lot of what's included in my written testimony is, you know, coming at some of the same points that Molly and Vicki made from a slightly different angle. So I'll kind of breeze over some of those given the time restrictions. For those of you who don't know about Voices, we are an independent, multi-issue child policy research and advocacy organization. And our mission is to enhance the lives of children and youth. We're particularly focused on improving equity in our economy and institutions in order to ensure that every Vermont child has what they need to thrive. So I'm also wearing another hat today, which is that of the kind of de facto coordinator of the Vermont Paid Family and Medical Leave Coalition. We are a diverse group. I think we have 21 organizational members now, including advocacy organizations that represent people with constituencies across the lifespan and in different situations, as well as business groups. And I'm here to say that H66 in its current form is a very strong and equitable bill, and we're pleased to support it. So again, both Vicki and Molly have talked about the lessons learned from the 11 states and DC who have had comprehensive paid leave programs in place for up to 20 years in the case of California. And so we really don't have to recreate the wheel. We know what the essential elements are of a strong, equitable program. So just to recap, that's universal, all in, all workers, all kinds of businesses, and not voluntary. And there's a couple of reasons why we really feel strongly about it being universal versus voluntary. One is really about, and I think Molly spoke to this, about how to make a program that's sustainable and affordable to everyone in it, and having everyone in it as opposed to dealing with adverse selection where people kind of sign on knowing that they're going to use it. That drives up the cost and impacts sustainability of the program. There's also research that shows that if you leave this to individual workers to decide, that they tend to underestimate the likelihood of them experiencing a covered medical condition that they could avail themselves of this program. So, and then finally, just kind of universally, voluntary plans tend to worsen disparities in access. So low-wage workers who are already less likely to have access to any kind of paid leave other than the 5 paid sick days we passed a few years ago will continue to be left out. Comprehensive coverage, we've talked about that, the kinds of leave, the reason why 12 weeks as a base is so essential for bringing a new child into a family. Adequate wage replacement, that's also been covered very well. And I think I like to point to the California example because they are the oldest comprehensive leave program at 20 years, where they started with a wage cap that was, I think, 55%. They started noticing who was and wasn't availing themselves of that program, moved it up, and then just last year have now moved the top of their leave, of their wage replacement level to 90%. So a strong wage replacement is really critical to ensure that, in particular, low wage workers can access the program, because you could imagine that if you're making minimum wage or less than what's considered a livable wage in Vermont, you need every penny in your paycheck to cover your costs. Inclusive family definition, we're very supportive of that. There was some
Michelle, 1 second. Sorry, we have a question.
Hey, Michelle, This is Scott.
Hey, Scott.
I'm sorry I had to step out for part of your testimony, but I heard that you were on the California thing. And
Yeah.
I remember 2 years ago when this family paid leave bill came through, that bill, they made the conscious decision not to include self-employed people because California, the rate that they were charging their self-employed people was massively larger than the rate for their W-2 employees. And we didn't really want to touch that because it was just such a difference. Does that sound familiar? To you or Molly, I guess, to see Molly popped in here.
Yeah, I'm happy to let the national folks, I will say that I'll let the national folks answer it, and then I'll see if there's anything more for me to say.
Whichever one of you wants to nod at each other first. Yeah.
So it's true that California unusually anomalously charges a whole lot more for self-employed folks to opt in than for employees who already pay 100% of the cost in California. That's weird, funky California stuff, which is also why usage is super, super low among the self-employed. The numbers have fewer digits than you think they should have. In California, that has not been the national trend. So now, as opposed to a couple of years ago, we have a lot more states that have been allowing folks who are self-employed to opt in. So New York does, Connecticut does, Massachusetts does, Washington does, basically all of the DC does, all of the newer programs do, and nobody does the thing that California does, where it's just like a weirdly massively higher number that's even calculated in a different way. Instead, what we've seen in other states is either you just pay the same amount that would in total be paid for an employee who makes the same amount, because that's how your benefit's going to work out, right? It's proportionally the same money. Or in some cases, they adjust it to be the same amount that a worker who makes the same amount would pay and absorb the employer contribution. But basically, California is an outlier. We've seen a lot more about how to do things smart in other places. And in particular, from what we've seen about uptake, I think as opposed to when California was the only one, I think we now have the data to show that you're not going to have the kind of like massive influx of every single self-employed person in the state opting in that would mess with your numbers. Overall, like what I think is likely is you'll see folks who opt in, and there's good safeguards against that kind of adverse selection problem built into this bill. There's a minimum time commitment. There's, again, like really smart best practices. But basically, you get the benefits of the self-employed get to choose. But because it's in the context of this big universal program, that really mitigates some of the harms. All of which is just to say, don't do what California's doing. What California's doing is crazy. You have a lot of other good examples to look to that are not doing that kind of really funky, bizarrely high rate.
So just if I can confirm, so other than California, all these other states, do the W-2 employees, do they have the same contribution rate that the self-employed person does?
It varies. So in some places, it's an employee and a self-employed person who make the same amount pay exactly the same amount. Okay. In other places, so like Massachusetts, for example, where there's both an employee and employer contribution, the self-employed person basically pays both. That's similar to the way that like Social Security works.
But it's the same amount of money that.
It's the same total rate.
Okay.
There's no place where the total rate is higher for the self-employed. It's just a question of how you're slicing and dicing.
And the bill, just for folks who are following along, the bill as left, House General, has self-employed be paying sort of the employer and the employee share.
But the same total.
But the same total.
Total rate, yeah.
Yeah, the same total rate. Michelle, do you have anything else you want to share to wrap us up here?
Oh my gosh, I barely started, but okay. Okay.
And you can come back in. I know, we know where to find you.
Okay, that's fine. Maybe I'll just close by sharing at the bottom of my testimony. I just ran the numbers for Voices. We're a small nonprofit business. We have 5 to 7 employees typically. And over the past 5 years, we have had 2 staff members go out on paid leave, and we currently offer 6 weeks of paid leave at 100%. Plus, we have a very generous earned time off policy that people can then kind of combine that. So twice in the past 5 years, we've had folks go out for 6 weeks. And when I looked at how much we'd paid for that, it was about $10,200 in wages. And in one case, we did actually hire a temporary person. So we had that additional expense on top, another $4,000 to $5,000. If I look at our payroll during that time period, if we had been paying the full 0.55%, which Voices would, that we would have paid about $10,300 in premiums over that this is 5 years. So basically we would have paid in premiums what we paid in wages for employees to get half as much leave. So if we were paying, I mean, it's a no-brainer for us. And I would say we also encounter I wrote this in there, but one of our funders that was funding one of the folks who wanted to go out on leave asked us about it and said, don't use our grant funding for that paid leave, despite their ostensible equity-focused mission. And so we had to pull that from our reserves. And so on every level, having access to this plan would have really benefited our organization and our employees.
Thank you, Michelle. I really appreciate that because we talk so much about small businesses in Vermont, but I think sometimes we forget how many Vermonters are employed by small nonprofits too. So thank you for that perspective. And we'll see you really soon. Thank you all. Thank you, Vicki.
Thank you so much.
Molly. So deep breath, pivot to a new topic. Maybe I'm the only one who needs a deep breath in between subjects. I do a little clearing of the mind. So I inane small talk for a moment while my mind clears. And we are going to talk about the yield bill and a new Ed Fund outlook that Julia is going to share with us. If you want to come up, Julia. So we sort of talked about why we were looking at this Ed Fund outlook last time Julia was here, but now we have a nice new Ed Fund outlook to look at. And so if you could talk us through that, that would be great. Thank you.
Sure. So for the record, I am Julia Richter with the Joint Fiscal Office. Thank you everyone for your patience last Monday whenever I was in here and had not updated some of the summary lines. So we've got in front of us the Ed Fund outlook that reflects the same construct that I talked through last time, but with all of the numbers reflecting the constructs we're talking about. So would you like me to share my screen with the Ed Fund outlook?
Sure.
Okay.
Or,
Either way.
yeah, let's do it.
Whichever is.
No, please do.
Okay. So let me just pull it up. And it's also available on the committee page under my name. So I'm gonna do that now. Okay.
Magic.
Okay. Great.
Can you make it a little bit bigger?
Sure.
Thanks.
How's that?
Well, a little bit more. Look at that. Okay, thanks.
Is that good?
Chris is laughing at me, but you're much closer to the screen.
I am way closer.
Okay, so just for a quick reminder of what we're looking at here. We've got the Ed Fund outlook. It's not reflecting the school budgets that Brad spoke about on Monday. It's still reflecting the estimated school budgets that were in the December 1st letter. I've added, because we're starting to look at a lot of different ideas, just these column qualifiers on the top, A, B, C, and D, so it's easier to talk about. So A, that's FY 2023, that should look very familiar. B and C, we've already walked through in previous times. B is really just reflecting the governor's recommended categorical aid updates. Column C, it's the categorical aid updates included in GovRec as well as universal school meals. Right now we have that placeholder of 29 million. And then column D is the new construct that we're looking at here, that the chair asked me to include a tax rate offset reserve. So just scrolling down here, remember we're looking at this final column here, which is the new one we haven't looked at before. And in line 34, we see a tax rate offset reserve of 50 million. This is a 50 million I was asked to put in because the prior year unreserved and allocated were about 100 million above forecast. So placing half of it in the tax rate offset reserve is why that number is 50 million. So that's the construct we're looking at. And before opening it up to questions, I'll just touch on a few of the summary lines that we're looking at here. So recall that in lines A through I, these are our summary. So this is telling us, what is the average tax rate? What are the yields? And we've also included the average percentage bill change compared to the prior year. And we've included this because we remember the grand list has really grown. So interestingly, we're seeing in line A here, the average homestead property tax rate. Often people use this as sort of a gauge of what's happening with taxes. But in reality, we see that the average property tax rate is decreasing in B, C, and D, all of these new constructs. But just because there's a decreasing tax rate doesn't necessarily mean that there's a decreasing liability, as I know the committee is well aware. So because of all of this growth in the grand list, we see in line F that the average percentage bill change compared to the prior year is increasing. So while the average rate is going down for homestead property tax, the average bill is increasing. And that average bill change is the same across all three categories. So that's how this has been modeled. So the average bill change for homestead property, income, and non-homestead is all increasing by the percentage based on the construct.
I just want to make sure I'm following this. In lines A and C, those tax rates, average tax rates, do not include CLA. Is that correct?
Yes.
Okay.
So everything that we're looking at here is equalized.
Okay.
So they're not including CLA, but we can compare across, because they're equalized, we can compare across all towns. So this is not what people would be seeing on their tax bill.
Right. Doesn't change line F at all.
Doesn't change.
Line F is what it is. It is what it is.
Correct.
Okay.
Mm-hmm.
Okay.
Julia, I'm just looking at lines D and E. Why, if in column C, if the tax rate, if the rate is going up in line C, why is that number line D and line E going down in column D?
Yeah, so that is a great, I'm glad that you flagged that. That's a great point. When we think about the property yield and the income yield, we can think about how those yields fit into the tax rate calculation. So the yield is the denominator. So the bigger that the yield is, the lower that the tax rate is.
Okay.
So while if we are seeing increasing rates, then we're going to be seeing decreasing. We're seeing increasing rates and we're going to be seeing decreasing yields. Yeah, it's a converse relationship.
Thank you.
Yeah, let's do Representative Meadows, because
Oh, okay. Keep going. Okay.
he's not usually as excited about
Remind
this.
me, on column B, includes government recommend categorically. What was that recommend?
Yeah, so that is for lines 11 through 19. Those are like the adjustments to the special education aid, state placed students, transportation aid. So it's really like more of the formulaic
Okay.
updates for the year.
All right. Got it.
Representative Meadows? Oh, sorry.
So, Julia, in simple terms, we got $100 million unreserved. We're taking 50 of that, moving that for a reserve for next year for tax rates. And then we're taking 29 for universal school meals. So that's 50, 79, 21? Would that be 21? For tax rate?
Mhm.
Is that how that would work out? Just
Mhm.
simply thinking about it, where that 100 million is going?
Yes. And I would add that so yes, that's accurate. I would also add that there have been the updates for the governor's recommend.
Yep.
For the categorical aid, so that's being included in here. We're also seeing a lot of those unreserved, unallocated are updates from the revenue forecast coming in. And so last year we were seeing that tax liabilities were going down regardless if any money was being put towards tax rates. This year we're sort of seeing the converse, right? That tax rates are going to go up.
Because education spending is going up.
And so that's one of the big factors, because education spending is increasing. We also are looking at the performance in non-property tax revenue sources, growth in the grand list, all sorts of things floating in here.
Julia, last year we had in the unreserved, unallocated, there was money there for PCBs, and that was one time.
Yes. So great. Another great question. That's being picked up in line 33. So you recall that the yield bill last year set aside dollars $22 million for the PCB reserve. And then there was sort of that contingent appropriation where if there were additional dollars in the bottom line, ultimately the PCB reserve was filled to 32 million. It was one time and it's sitting right there. 2.5 million was let out of that reserve by the E-board this fall to A&R AOE.
And my understanding is that the Agency of Education and the Agency of Natural Resources are still working with the Education Committee to put forward a comprehensive plan to how to actually spend the rest of that money staying in the reserve.
Okay.
But that plan has not been fully anything yet. Yeah, Scott.
Just a comment. Line 10. That this number is the number that 1711.9 or 1712 is the number that was in the tax letter. If the decrease in spending that Brad is, hasn't really ready to commit to yet, but it's looking better, that would reduce that number, which would help everything.
I don't know if I'd call it a decrease in spending as much as a slightly lower increase in spending, but yes.
Relative.
Yes.
About an $11 million less than we thought in December.
Yes.
What? You're saying about 80, right?
And Julia, the next time, will you remind me sort of at what point you would feel comfortable updating that number to match Brad's numbers?
Yeah, I'll talk with Brad. I do want to defer to him. It sounds like he's got the bulk of the budgets in. So I'll see if he feels comfortable or if he wants to wait for Burlington.
Mm-hmm. I think I would feel comfortable waiting for Burlington. I also know that their budget's warned and somehow, like, it's publicly available information. It's just not in Brad's email yet, so.
It's a 4%.
Okay. Really?
Yeah.
So we can help Brad find that information, I think.
Yeah. And
That's good.
one,
It's hard to.
Sorry.
Thank you.
one comment on that is we try to freeze the Ed Fund outlook in certain periods so that we're comparing apples to apples instead of apples to oranges. So we would probably freeze it once based on the updated budget information and then wait again until the school budgets have been passed in large part before updating it again.
Thanks. Anyone else? Okay. Thank you very much.
Thank you all for your
Thanks, Julie.
patience.
Thank you.
Thank you.
Thanks.
And we are going to be back here at 1.